A warm welcome to all of you who are listening to this seminar. This presentation is part of the Family Empowerment Series. I am Dr. Selin Phillip. The focus of my presentation is to address the age-old yearning of human hearts. How can we overcome depression? In my 12 years of clinical practice, two of the most frequently asked questions I've heard are, can a true Christian feel depressed? How can I hope in the face of depression? In this seminar, we'll be looking at some vital information on depression as a disorder or disease and addressing these questions briefly. One of the oldest documented stories in the Bible is a story of depression. It is the story of Job, the well-known blameless and upright man who feared God and turned from evil. He was prosperous, blessed with children and great riches, and his fame had extended to all the people of the East. But only until the day God allowed Satan to smite Job and take away his property, his children, and his wealth one by one. A brutal test in the life of a godly man. As the story unfolds, we know that he himself fell ill. He was rejected by his own covenantal partner, his wife. She asked him to curse God and go and kill himself. We know very well about Job's physical pain, his deep faith, his perseverance, his patience in the face of suffering. But we seldom talk about his mental anguish. When we study deeper, we find that Job also experienced deep emotional suffering and confusion. He spends the rest of the book crying out to God. An example of his deep pain is recorded in the book of Job, chapter 30, verses 16 to 36. I'll read out a few of those cries here. And now my life seeps away. Depression haunts my days. At night, my bones are filled with pain, which gnaws at me relentlessly. God has thrown me into the mud. I'm nothing more than dust and ashes. I cry to you, God, but you don't answer. I stand before you, but you don't even look. You have become cruel toward me. You use your power to persecute me. And I know you are sending me to my death, the destination of all who live. Depression is as old as humanity, at least since Adam and Eve fell into shame and pain and were driven from their state of peace. Suffering, whether it manifests in the form of physical, relational, emotional, or psychological, comes to all of us. What does depression look like? How is it felt like? Scientific conversation on depression can go back to Hippocrates, the father of the modern medicine in the 4th century BC. He and his other successors believed that depression is a biological disorder. In the academic work on depression in the ancient times, depression was referred as melancholia. There are some differences between melancholia and diagnosis of major depressive disorder in the modern times. Yet, the biomedical concept of depression underlying these terms is similar. The term depression stems from a Latin verb, deprimere, which means to press down or depress, and it refers to the state of dejection, the state of being pressed down, and a sinking of the human spirit. A person with depression feels like There are external forces pressing down on him or her, causing them to sink. If a person is depressed, regardless of cause or severity, they will most likely show most of the patterns of thoughts or action that I'm going to share here now. Number 1, low mood, nearly every day, or empty mood, or it can go to the extent of experiencing mental pain and anguish. Loss of motivation and pleasure. With depression, a person often loses interest in the things that they used to do before. They feel a sense of meaninglessness, which leads to the inability of experiencing pleasure or joy. The third symptom is loss of energy or difficulty with thinking and focus. People with depression feel physically exhausted most of the time. They are not lazy when they are unable to complete everyday tasks such as paying bills, finishing yard work, doing the laundry, preparing a meal, or cleaning the house. Teenagers often experience lack of interest in study or pursuing a career or pursuing a relationship, along with some other symptoms. Problem sleeping is another symptom. Some people have trouble sleeping, which is called insomnia, and some others lie in bed all day and night, which is hypersomnia. Often, the worst thoughts occur late at night, and for those who sleep all day and night, don't feel rested. This results in physical exhaustion, which can lead to other problems like anger, irritability, social problems, and medical issues. We also see change in eating patterns. This can go either way. Some people have little appetite and lose weight, while others constantly eat to fill the emptiness. These symptoms that manifest in the body shows that depression is felt not just in the mind but also in the body. We also see new physical illness, headaches, backaches, neck aches, joint pain, fatigue, gastrointestinal issues, and there are other numerous physical symptoms that are part of depression. Specifically, among Asian communities, we see more of somatic or physical symptoms because we do not talk about our mental anguish due to high stigma of mental illness in our communities. These physical symptoms are real. Their pain is real. Yet, until the depression is treated and the contributing factors are addressed, the physical symptoms will not be resolved, and it become mystifying to the doctors and the patients. Some other symptoms are impaired thinking and memory, difficulty in relationships, difficulty with physical intimacy, anger and irritability, feelings of worthlessness, and fear of losing one's mind. I also want to briefly discuss two other important and highly stigmatized symptoms of depression. They are suicidal ideation or suicidality and non-suicidal self-injury. An American psychiatrist, Dr. Peter D. Kramer, who specializes in clinical depression, once said, "Suicide is what the death certificate says when one dies of depression." In the midst of a severe depressive episode, a person may come to believe that suicide is the only option they have to end the intolerable suffering. I want to emphasize that many people who, for moral or religious reasons, would never consider suicide as an option when they are in a normal mental state, and who normally flinch back in fear or horror at the thought of taking their own life, nevertheless consider taking their own life when they are severely depressed. This is one of the great tragedies of depression. But suicide is a word that provokes fear, shame, and sadness, especially in Asian cultures like India. But we cannot be silent anymore, and it is high time to talk about it. The recent National Survey on Drug Use and Health reported an estimated 17.3 million adults in the United States had at least one major depressive episode. This number represented 7.1% of all US adults. About 3.2 million adolescents aged 12 to 17 in the United States had at least one major depressive episode. This number represented 13.3% of the US population aged 12 to 17. But please know that among this, 3.2 million adolescents, which is 11.3%, is Asians. That is a significant number. And the figures we see from research in India are startling. Recently, in a medical journal, Lancet Public Health, researchers have reported that India accounted for 37% of all suicides reported globally for women and 26% for men. In 2016, an estimated 230,000 plus Indians died of suicide. Suicide is caused by many factors such as mental illness like depression and other psychosis, the abuse of alcohol or drugs, and mental anguish caused by social issues such as bullying, domestic violence, sexual abuse, and dowry-related deaths in our communities. Another symptom of depression is self-harm, or a symptom called non-suicidal self-injury. It involves any behavior where someone causes harm to themselves, usually as a way to help cope with difficult or distressing thoughts and feelings. Either suicidal ideation or self-harm is not a mental illness, but a behavior that indicates a need for better coping skills. Several illnesses are associated with self-harm, and one of them is depression. According to the London-based Lancet Commission on Adolescent Health and Well-being, self-harm is the leading cause of death among Indian adolescents and young adults aged between 15 and 24, followed by road accidents. How astonishing! Can we afford to be silent anymore? Our generation is hurting. The next generation is silently weeping. How can we judge and condemn the silent sufferers in our communities anymore? Those who have not personally experienced it may not fully realize the intense suffering depression brings. And those who suffer from depression suffer silently, misunderstood by others. This is an urgent call to address the mental health epidemic in our own communities, in our own churches, and in our own homes, and reduce and gradually remove the stigma of mental illnesses. Yet, before we can address the symptoms of depression, we must know what is causing it. Why am I depressed? Is a painful cry of the heart that I hear more often in my work. Here are some common factors that can lead to depression. Our beliefs about these factors are based upon our beliefs about what are people made of. Those who believe that we are just physical bodies reach for only physical cures like medication to treat depression. On the other hand, those who believe the body is just a temporary container of the soul tend to minimize the impact of the body and focus more on the soul and make it exclusively spiritual. Yet, we as Christians believe the Bible emphasizes the unity of the person, the mind, body, and soul. Based on this belief, depression should be addressed as a whole person disorder. In depression or any mental or even physical illness, we must consider the person as a unity, because it is not possible to separate whether someone's depression is only spiritual, only biological, or only psychological or social. Human behavior and emotions cannot be simplified into a mathematical equation, and so the causes for depression are multiple and complex. We will look at them from a biological, psychological, social, and spiritual perspective. As with all mental disorders, depression also can be heritable. First degree or immediate relatives of individuals diagnosed with a depressive disorder have a 2 to 4-fold higher risk of having a depressive disorder. This does not mean that if you have depression, your children will surely have it too. But it is that they will be vulnerable to having depression, like someone with breast cancer or ovarian cancer or diabetes may pass those genes or a combination of those genes to their children. The neuroimaging studies have also shown variations in some parts of the brain of those who have depressive disorder. Like I mentioned in my last presentation on anxiety, alterations in some specific neurotransmitters in our brain lead to abnormalities in sleep, concentration, attention, and memory that are often seen in depressed patients. The brain is one of the mysteries of God's creation that we are only starting to understand through science and medicine. Newly emerging studies provides us with an understanding of the brain as functioning primarily through connections between the neurons or the chemicals that we call them, and through how the brain gets wired and rewired in a process called neuroplasticity. Our brain is constantly changing and adapting and strengthening the pathways to make them more efficient and removing those pathways that are no longer in use. The psychosocial factors include loss of some form, like loss of a person through death, which also includes miscarriage, loss of relationship through divorce or breakup, loss of a job, health, or loss of a home. Some childhood factors include abandonment, neglect, physical or sexual abuse. Other risk factors can be little or no social support, socioeconomic status, and chronic or disabling physical conditions. Depending upon an individual's vulnerability, which is influenced by developmental and biological factors, stressful circumstances can precipitate depression. But please note that no two people react in the same way, even to the same stressor. For instance, two children in the same family can respond differently to the same stressor, like the death of a parent. Use of drugs and alcohol can affect a person's mood. Alcohol works as a depressant. People often turn to alcohol to relieve from the pain of life and depression while intoxicated, but it can worsen depression. Certain medical conditions such as heart conditions, stroke, cancer, and brain injury have a strong relationship with depression. Some other factors are hormonal fluctuations. For instance, pregnancy and delivery cause large fluctuations in hormones, and along with the stress that comes with parenthood, it can increase the risk of developing peripartum or postpartum depression. Inadequate sleep can cause irritability, difficulty focusing, increased negativity, and ultimately lead to depression and anxiety. What are some spiritual causes? All suffering, whether it is physical, psychological, behavioral, or relational, has a spiritual reason. Whether we experience headache, fever, COVID, or cancer, or we suffer from anxiety, depression, or any other mental illnesses, The ultimate cause can be traced back to our sinful state and the far-reaching consequences of the fall of humanity. Our painful experiences, tragedies from childhood, the frailty of our minds, the brokenness of our bodies, our predisposition to depression or cancer leads us to the brokenness of humanity by sin. But thanks be to God, our story doesn't end there. More than 80% of people with a depressive disorder improve when they receive appropriate treatment. God has given humankind the intelligence and wisdom to understand depression by looking at brain images using neuroimaging techniques. He has helped scientists to develop medications to treat depression and psychological theories and techniques to help the suffering to develop healthy coping mechanisms, to live well and change the information processing system in our brain to think, feel, and act better. Moreover, we have Jesus who modeled compassion in his ministry to the suffering. Let us look at these gifts of treatment briefly here. Antidepressants or medications are prescribed to alter the levels of chemicals or neurotransmitters in the brain. These are usually taken for 3 to 8 weeks before the full effect of them is experienced. Psychotherapy or counseling. Research have shown, and in my own experience of clinical practice, a combination of medication and psychotherapy is more beneficial than either treatment alone in moderate to severe cases. In the case of mild depression, psychotherapy can help without the use of medication often. The antidepressants could help with growth of new neurons or chemicals in our brain, while psychotherapy using cognitive behavioral therapy or interpersonal psychotherapy or other any psychotherapeutic models could strengthen the positive brain connections in the way information is processed in the brain and passed on from one part of the brain to another. Other healthy strategies that could help the growth of new neurons and strengthening them are adequate sleep, good nutritious food, and exercise. Social treatment. Our relationships are vital for our healing. We are created for connection. I would like to share a personal story with you to give you the impact of our relationships on our mental health. 10 years ago, I buried my 52-year-old mother's body after 6.5 years of her excruciatingly painful battle with cancer. Even though I had witnessed her agony and suffering, and I knew she was present with Christ, nothing could prepare me for her bodily death and her painful absence in my life. After the dust settled, I began to drown in my grief and found myself having depressive feelings and related physical symptoms. As a clinical mental health counselor, I was deeply aware of what I needed. It was comfort and validation from godly people. Besides my husband who stood by my side, God provided 2 people to come alongside me from miles away. They were not clinical counselors by profession, but they were praying, understanding, and listening individuals. They did not give advice or quote scriptures to bypass the feeling of pain of my loss. But they listened, they prayed, they allowed me to feel the pain, they validated my suffering, they cried with me, they checked in on me, they made more impact on me than I could ever repay them for. Today, I grieve my mother's loss and feel her absence, but I am not depressed. That is primarily because 2 people willingly walked with me through my loss and grief. God manifested his healing presence through them. Church, family members, Our mission is not to condemn or judge or pass opinions about someone's suffering, but it is to walk alongside them, just as Christ would do. The last but the most important treatment is spiritual. No treatment of any disease is effective without God's intervention. This is the same in depression. To explain this further, I would like to bring another example from the Bible. That is our all-time favorite king, King David. Of the 78 Psalms authored by David, over half of them depict his great personal sorrow. A study of Psalms has taught me that the descriptions of his depressive experiences are similar to what I hear from those suffering with the depressive disorders today. He has expressed the mental anguish, the physical pain felt in depression, the overwhelming loneliness of being trapped in a pit of darkness, and the terrifying spiritual isolation he felt from God. His laments through the Psalms teach us that it is okay to feel the pain. We do not need to stop feeling the pain to have faith. We do not need to bypass our grief and emotional pain to draw near to God. We have faith and we draw near to God, not despite our mental suffering, but through it and in it. David found relief from his suffering in God's unchanging character, his infinite faithfulness, and his unconditional love. Even when he felt far away from God in times of deep mental agony, he spoke with God, like we see in Psalm 13. He cries out, "How long, Lord, will you forget me forever? How long will you hide your face from me?" By bringing his sorrow and pain to God, David found hope in his presence. Can Christians feel depressed? Yes, they can. If you or your loved one are suffering from depression, you are not alone. Beginning from Job through David and centuries later, people who had been mightily used by God, such as former President Abraham Lincoln, Charles H. Spurgeon, have all suffered with symptoms of depression. Today, millions of people, both Christians and non-Christians, suffer from it. Can you overcome it? Yes, you can. Treatment is available. Prayer works. God heals. I want to encourage the church community and families. You have a crucial role in encouraging the members who suffer with depression to continue to walk by faith and to look to God for hope and ultimate healing, while also pursuing physical and psychological strategies to heal from depression. To those who are suffering or have loved ones who suffer with depression or similar mental illnesses, I want to encourage you. Be courageous to seek the appropriate treatment. Talk with someone that you can trust. More than anything, never stop conversing with God, even when He seems far away. Like Annie Flint sang with affirmation, "He giveth more grace when the burdens grow greater. He sendeth more strength when the labors increase. To added affliction He addeth His mercy. To multiply trials His multiplied peace. His love has no limit, His grace has no measure. His power has no boundary, none unto men. For out of His infinite riches in Jesus, He giveth and giveth and giveth again." Whatever affliction, struggle, or trial you face today, this is your hope. God gives more grace. His power in your life has no boundary. May He keep giving you grace upon grace upon grace, and may you receive it willingly and humbly.